Hello all, this is Dr. Dheeraj Masapu. I am a consultant anesthesiologist, and today I would like to talk about salaries of anesthesiologists in India, and I would like to compare them with salary of anesthesiologists in other countries, and also let me compare it with the surgeons. Okay, so salary of anesthesiologists in other countries like USA and UK, if you see, they're pretty high. Okay, and actually they're more than surgeons in that particular places, and in USA roughly they get about $300,000 per year minimum, and it might be more than that. So it might be more than surgeons, or it might be on par with them. Okay, so why is that so? Because in developed countries, the hospitals and the management and even the people understand the value of anesthesia and the value of safety, and they understand what happens if the anesthesia goes wrong, that so many things can go wrong and a patient can even die if anesthesia is not given properly. So these are the things they understand, so that is why they are paid on par with surgeons. Okay, so let's come to India and see what happens here. So this is, I don't want to do a pessimistic video about anesthesia. I love the branch, but in India, and why I'm doing this video is that there are reasons why people are leaving India and going to other countries like Middle East, USA and UK. That is why I'm doing this video, so that people in India understand actually where things are going wrong. Okay, because if anesthetist is being paid on par with surgeon or on par with other specialties in India, why would a good person, a good anesthesiologist leave country and go to some other nation? My close friends have gone to Middle East because they're being paid more there. They're not they felt that they're being undervalued in our system. Okay, so if we can change this, we can retain good brains in the country, and the country also can progress in the healthcare industry. So that is the reason I am doing this, not to create some kind of a negativity into the branch. Okay, hope you guys understand. This channel is not for that kind of discussion. So what we need to let me tell you how the anesthetist gets paid in India. For example, let us not talk absolute values because it doesn't make sense, because I get paid some amount, you get paid some amount, and it depends on the center where you do and the place and multiple things. Okay, so let us let us take a particular center, okay, in a city. For example, a surgeon gets an X amount, and then an anesthetist with equal experience and equal knowledge would get maybe one-third of that or one-fourth of that. So people are very happy and comfortable with that. Nobody questions, even the management, nobody questions the system, and they happily take the salary and go home. Okay, so problem is there with us also partly, and even if you try to raise the question saying why is the difference there, and management or the hospital system will try to tell you that it is a service provision sector. Okay, so you are not getting the patient, surgeon is getting, and he is operating. So obviously surgeon will be paid more, and you are beaten down with that kind of so if somebody tells you that, you will be like, okay, let me take some one-third of a salary of surgeon and let me go home and spend some time with my kids and everything. Why should I get into trouble? Anyway, I'm not generating the patient. If I talk more, they might replace me with some other anesthetist, because now the production is increased, and if you want 10 years anesthetist, they are available. If you want 5 years experience anesthetist, they are available. So if I talk more, they might remove me. That is the kind of fear you have in your mind, so you don't risk. I can totally understand. Okay, and I don't recommend also to go and fight with the management or fight with the society to raise your salaries. This is not for that. But what I really feel is the system in India don't really understand the value that anesthetist brings onto the table, because the kind of service that we give is not projected properly, I feel so. See, the kind of work that surgeon does for surgery is being marketed, it's being projected outside. If somebody does a robotic surgery, it is being marketed. If somebody uses a laparoscopic surgery, it is being marketed. But for example, if you are using a fiber optic intubation, it is not marketed outside. You don't tell anyone that you do that. If you are doing some kind of neural monitoring or bispectral index monitoring, if you are trying to monitor the depth of anesthesia in a patient and try to give a very good dose of anesthetic without overdosing or underdosing the patient, you are not trying to market it. It is partly your problem also. So, and say, hospital doesn't want to market you because patient do not directly come to you. So you need to, as an anesthetist, you need to market yourself. Okay, you need to tell people that even I have gadgets, even I have the kind of equipment surgeons have, and even I'm equally important in the system. If I add the same value a surgeon does to the table, and I am part of your care. That is the kind of message you need to give. Okay, so no, we are making guidelines, we have a lot of societies and we are trying to do that, but is it reaching people? Is it reaching public? You have to answer the question. Keep your hand on your heart and try to answer this question. Is your guideline, is your this thing projecting the kind of work that you're doing, okay, like a surgeon? No. Answer is no. And hospital has an obligation to promote a surgeon because patient should come, but they don't promote you. They're not anti towards you, but the thing is that they don't have an obligation. Okay, so you need to project your work. You have more responsibility than a surgeon, so you have to. I don't know what portal you use, how you educate. Maybe see, I'll ask you a simple question. You have so many relatives. Do they know what you do? Most of them don't know. They will be thinking that you'll be giving some injection and patient is going to sleep. So you didn't even educate your relatives, and you didn't even tell your parents what you do. Then how can you expect the society to know, and that to a country where the education level is low, to know about what you do? And only then, when that changes, your salaries will go up. Okay, so hope you're trying to understand. I'm not trying to raise some kind of a revolt or anything among the anesthesiologists. What I'm trying to tell you is, you didn't educate people. You didn't tell even your relatives what you do. So how can you expect equal salary with a surgeon when the surgical societies actually try to market their skills and what they do to the patient, what kind of care they do? Since generations they have been doing that. Okay, we have stayed behind the screen and we have done a mistake. Okay, so I can okay, on the other side, if you think we have stayed behind the screen because we maybe felt that is comfortable and we would have focused more on patient care and all that, but they are also doing that. They are also giving patient care. They're parallelly they were doing this. So, and the reason why they did that is they had to get patients and they had to compete and they had to market their skills. There was an obligation. For us, we didn't have to do that. So since they are doing and they were calling us for the cases, we were comfortably sitting and we didn't market our branch. So only when we start marketing our branch, when we start telling people what we do, things will change. Okay, in developed countries, what happened is they did not market the specialty of anesthesia, but people and system are educated. Okay, people are educated in such a way they themselves will go and do research and they will try to understand where the risk actually lies. The risk actually lies when you give wrong anesthesia, when you give overdose of anesthesia. There is a chance of dying when you give anesthesia. Okay, so during surgery, even if you cut a major vessel, you can put pressure and stop that, or you can do some kind of you can at least halt the thing. But while giving anesthesia, there is a high possibility that patient can die. So these kind of things in developed countries people try to read and understand, but in our country with the educational level, you don't expect people to know about anesthesia. They have bigger things to worry about because world is more worried about things that is projected to them. Okay, so if some stock of Adani is falling or if some accident happens, they are more focused on that, but they will not use their energy to know about anesthesia. It is your job to teach them. And so okay, then what should we do? Just start teaching, start educating your relatives. Start with your family first. Start with your brother and sister and try to educate them what we do, and then slowly things will change over a period of time. I'm not telling if you start educating now, but from next year things will change. Things won't change. Things will take some time to change. Okay, if you guys start doing this, And since our ancestors didn't do, if you start doing this now, maybe 10 years down the line, by 2033 at least, the anesthesia in India will become on par with surgery. Otherwise, don't expect the kind of salaries on par with surgeons. And I really appreciate the ancestors of surgeons and what they have done, whether they have done on purpose or whether they had to do because they have to get patients or not, I don't know, but they have done a good job. Okay, and so that's it, guys. I hope this video you like it, and I'm going to keep this video only for a few days because I really don't like to talk about this kind of stuffs. Okay, hope you like it. As usual, Dr. Dheeraj Masapu logging off. Roger that.